So just as a global picture, before I went into a little bit of the data that we've collected about the apps, what is PhysioU? Really, PhysioU has been a dream of mine to create a resource that is infinitely updatable, that is heavily video-based, that can achieve things and augment our classrooms in ways that the traditional resources that we have cannot. And so, not to say I want to replace all textbooks, I'm saying I think we can help learning improve and take it where the textbooks cannot achieve. We can help build that bridge. And so you'll see as we sample different parts of these apps, there will be no way we can match the depth and the masters that have created a lot of these textbooks. They will be embedded within our programs, and I think for good reason. I still use textbooks. But there are certain things that I really had a hard time achieving as an academic, as an instructor, that I think the apps have really begun to help build that bridge to clinical relevance for the students. And so this is a collection of ever-growing apps that are continuing to be updated, and new apps are continuing to be built. So that's what PhysioU is. So the main objectives for today is to share some common faculty challenges. So we have a summary of emails from different faculty who have noted, here's some common things that we're having trouble with in the classroom. And I think that helps to set the stage for why we've created this. And to talk about how we've been integrating these apps into our classroom. And to look at some of the data from our students telling us, this is how it's helping me. And finally, to be able to share some ideas and needs. So we are constantly building new apps. We are connecting with new faculty to build things that we think will enhance the classroom. And so we'd love to collaborate and to be able to chat about that. So some common issues from faculty. So a lot of them have said, we're in a motor skill type of profession. So a lot of my students want to see things. They want to see it before they perform it. And looking at pictures and reading text just doesn't do the job anymore. And so this matches for a lot of, some of the classes that we teach for MSK, for musculoskeletal, there's so many skills involved that it can be so overwhelming for the students. Too many resources, too much information. So yes, we have been trying to centralize a resource for the students that is at a push of a button on their phone at any point in time. They can access things to look at, to continue to learn, to review or preview content. As you all know, the amount of material we have to cover, I think this is an important question for all of us as faculty to ask. How much is enough to create relevant clinicians, and how much can wait to Con Ed and residency and fellowship education? We are constantly trimming content, and you'll see in our apps that we've tried very hard to leave out lots of extra stuff because the students just can't handle it. I don't think so. And assimilating these large amounts of material and figuring out how to apply it instead of just memorizing it. So as you know, we only have our 5 hours or 8 hours with our students every week. They're jam-packed. And the students know that at the end of those 6 weeks, there's going to be a test. And really, if I think among us as faculty, we know that ultimately what we hope for is that all of this content will be actually integrated into their minds so that they can function as clinicians, not just be overburdened with tests and techniques and exercises that are just scattered in their mind. They don't know what to do with. They don't know how to use it. And that was, some of the common challenges that our CIs were telling us. Hey, your students are coming in, they know all the tests, they know all the techniques, they just don't exactly know how to use them. So I think somehow in the curriculum we have to think about how do we integrate this content better so that the students are actually becoming clinicians even before they hit the clinic. And a few more common issues. Keeping resources current and evidence-based. So I'd written a Pocket Orthopedics, a little pocket guide, and had been waiting to update it. But the common methodology of the publisher is that the updates aren't necessarily required until the stock goes low. but we know from the evidence that things change all the time, and that's kind of what pushed us to move on to this web-based, infinitely updatable platform. Another big thing, Manny and I are both clinical practice guideline authors for JSPT as well as the Academy of Orthopedics. How are we going to integrate clinical practice guidelines into our curriculum in a easier way than just reading the entire thing? And so all of the clinical practice guidelines are built into our orthopedic apps. And I'll give you a glimpse of that in a second. Meeting the multiple learning styles that our students have, and also the challenge of searching all over YouTube for videos. So again, we've been filming patients to begin to build a library of content that faculty can use to create context. I think context is one of those big, really critical things that help to make everything else make sense. So I just wanted to take a moment, and Manny's going to talk about updating his lab handouts with pictures and videos and enhancing the lab experience. I just wanted to open it up just for a second to the group. Any other common challenges that you faced as a faculty member that you have used innovative ways to overcome them? So this is just open to the group here. Any comments or thoughts? Manny, do you have any quick comments or thoughts?
Sure. I don't see anybody typing anything right now, but yes, for our curriculum, so I teach in a problem-based learning curriculum where in semester 1, it's a musculoskeletal content semester where anatomy is one class, then examination documentation is another class, and then intervention is another class, right? So all three classes are linked together through the tutorial cases that our students have to sort of solve, right? So it's kind of like a problem. It's a case that the clinicians typically see, and they do this twice a week. And from that tutorial case, they they meet together with the tutorial leader, and then they sort of use this case to kind of like a foundation for all three classes. Now, after semester 1, they move on to semester 2, which is a neuro-based curriculum. And then semester 3 is medical complex conditions. And then now they come to semester 4, which is advanced MSK. And I lead one of the classes there. So we still have anatomy, we still have examination, and then we still have intervention. So in this case, the intervention is where I lead, for the students. And we include spine more heavily emphasized in semester 4, the spine content. And so the challenge that I get is that students have a hard time sort of connecting both semester 1 and semester 4 because, how does the spine relate to the, different joints that they learned in semester 1? At this point, they've gone to the clinic in the summer between the first and second year. So that's what I'm seeing when they come to semester 4. So the spine content is very new to them.
Yeah.
We had a little bit of introduction in semester 1. So that's the big challenge that I see.
I've had a very similar challenge in that we used to teach therapeutic exercise separate from orthopedic management, and modalities, of course, is a separate class, and a lot of those things were just completely disconnected by the time they got to the end of ortho, even though technically we had delivered that content. So let me